Welcome to your Route to Wellbeing podcast. I'm Sue Fullergood, and I'm absolutely sure that you deserve to feel great, and it's possible for you to pulse with energy. So if you're not thriving right now, or if there's something that's interrupting your thriving, then maybe this podcast is just what you're looking for. I've tapped into the knowledge base of experts in the 11 domains of well-being. Each of the experts has something that I think is part of the crucial knowledge that you need to be able to really take care of yourself. And so listen in and see if you can get that magical piece of information that's going to make the difference for you. Please feel free to share this with your friends and family, whoever you think may benefit from it. Please push the subscribe button so that you can be alerted when future episodes are available. Thank you for listening. Hi, I'm Sue Fullergood from the Energy Incubator, and it is really exciting to have Jon Patricios, Professor Jon Patricios, with us tonight. And I am really excited to download some of his brilliance out of his head and into all of our ears so that we can use his pearls of wisdom to help us on our route to well-being. So thank you for being here, Jon. It is really a treat to have you. And I want to say that I have known Jon for about as long as I can remember. That sounds terrible to say, but my whole career.
We won't give away how long to.
We won't. But just about my whole career, you've been one of those people that have always been there, always been available to learn from, always been available to bring patients to and ask for advice and send patients to, and your expertise has always been most welcomed and most helpful. So thank you for always being that. And I've actually been to see you a few times as a patient, so I can vouch for your expertise personally. And so without further ado, I'd really love to ask you, Jon, to just share with us a little bit about your career path and what made you take the choices that you did and move into the sports medicine arena.
Good evening, Sue, and thank you very much for having me. I think, you downplay your role in this field. You've been a stalwart for many years as well. So it's a great pleasure to be on this podcast and to talk to an issue that I think we're both very passionate about, and that is the role of exercise in our lives as humans and the importance of exercise and sport in promoting health and physical and mental well-being. I think that's critical. And I think that's probably what was attractive to me about exploring sport and exercise medicine. So when I undertook to study further after my medical degree, it was something of a gamble, I suppose, because there wasn't really a developed field, an established specialty in sport and exercise medicine. And I looked for an opportunity overseas to go and study. And I was very fortunate in being able to find a course that I could do. And it really sparked in me the idea that, we're trained as doctors to treat illnesses. But what if we could be in a situation where we could either prevent a lot of those illnesses occurring or actually use something other than medicines to treat them. And that is really what exercise is great for. And there's this maxim that exercise is medicine, and that's really what attracts me to the field. A lot of people think it's all about the elite sports stars, but there's so much more to sport and exercise medicine than that. And every day I'm learning how powerful exercise is as a tool, regular physical activity. And I just enjoy working with the type of people that want to incorporate exercise into their lives. So if I had to summarize the work that I do, it is so broad, but the common denominator is exercise. I see people who are exercising, who want to exercise or should be exercising. And so for me, it's a wonderful field to work in because generally those people are quite motivated and, like you, they want to really make a difference in their lives.
Brilliant. Well, thank you for that. And I know now that you are a professor at WITS in charge of the sports medicine department. Is that right to say?
We've established a research group there called WITS Sport and Health, which is aimed at elevating the research in the university in sport and exercise medicine. And the aim is to grow it into a department and a facility that can train sport and exercise medicine specialists and also train undergraduates and postgraduates in the field of sport and exercise medicine in a range of disciplines, including things like physiotherapy and biokinetics. So it's a great opportunity and an exciting time for the field. So lots of challenges ahead.
Awesome. So education is top of the pops for you. It's really something you've devoted a lot of your time to, and it's been a big part of your career. Well, you don't get to be a professor unless you're interested in education and academia. But I know you've written a whole lot of papers, and a lot of them have been in exercise. And I know you've also published a lot of papers about concussion. Do you want to just share with us a little bit about your interest in concussion?
Yes, I was a rugby doctor at one stage. I looked after professional rugby teams for 10 years. And certainly in the mid to late 1990s, one of the things that troubled me was that we didn't have good protocols to treat head injuries and concussion. Now, one of the difficulties with concussion, as I put it, is that there's no visible wound. So you can't see the injury, and even fairly sophisticated scans don't show us what's going on in the brain. And so we need really good clinical acumen to be able to discern what has happened to that athlete's brain. So I started looking into this and working with colleagues in South Africa and around the world to try and evolve some of our protocols, which we instituted at that level, at professional level, particularly in sports such as rugby. But what troubled me more than anything was actually what was happening at youth level and in schools where they didn't have that medical support. So we put together a series of protocols, guidelines, and educational programs under the banner of Sports Concussion South Africa, which really guided schools as to how to educate their children in what might be happening to their brains if it took a knock, and also bringing into the fold the coaches, referees, and parents. And with SA Rugby, we evolved this program called Box Smart, which was an educational and intervention program, which eventually became world recognized thanks to the work of people like Dr. Wayne Viljoen in Cape Town, who elevated it to a really world-class interventional program. And then from there, I got involved with international collaborative groups, the Concussion in Sports group, and the Concussion Consensus process, which has evolved into its 6th iteration, where we really evaluate all the science around sport-related concussion and put together updated protocols every 4 years, which we just published a month ago, actually. So that's certainly a very interesting area of my research, but probably a little bit of a diversion in terms of your show. But another area that we're increasingly publishing in is the area of physical activity. And together with the Center for Sport and Exercise Medicine, the department at WITS, who has some excellent researchers such as Dr. Georgia Torres, who really have a focus in this area, we've published some really good work which reaffirms the value of exercise as a tool in disease and in disease prevention. And some of those areas are areas that people might not think of. We're busy at the moment analyzing data with Discovery on their patients who have cancer and looking at the preventative power of regular physical activity in reducing cancer incidence. And now we're looking at a study that looks at those patients that have cancer and how being physically active diminishes the progression of that cancer. And actually your outcomes are much better if you exercise regularly. So that's an area that's becoming really a key focus area. Now, you can imagine why. If you think of something like cancer, it is obviously a diagnosis that no one wants to receive and potentially has devastating outcomes. The cost of the cancer in every respect can be massive in terms of the personal cost, the health cost, the cost to your family, and the financial burden, particularly in terms of some of the medications. So if we have a tool that we can utilize that helps reduce the impact of the disease and the cost, this really is a no-brainer that we should be advocating for this. And it's a win-win situation. Everybody wins. So the patient wins, the medical team wins, the insurers win because they're less out of pocket. And it's something that has really been underplayed for a long, long time. I think we've appreciated exercise, physical activity in terms of an intervention in things like cardiac disease, preventing high cholesterol, blood pressure, all that sort of thing. But there is not an area of our lives that regular physical activity and healthy lifestyle choices doesn't actually have an impact. And so it's really, really good to be part of this research, where we're also collaborating internationally. Quite a fascinating and I think very impactful area.
It is absolutely amazing how many systems of your body benefit from exercise and how little exercise is actually required to make a big difference. I think a lot of people feel totally overwhelmed by the idea that they have to go and run the comrades in order to exercise enough to look after their health. And really it is very, very little compared with that's required. Can you talk a little bit about how much exercise is the right amount? I mean, the ideal amount to get started with?
Absolutely. So the guidelines from the World Health Organization recently updated are that you need 150 minutes of moderate intensity exercise. So that means exercise where you're a little bit out of breath, but you're not exhausted. And if you think about that, I mean, that's 5 30-minute sessions a week. And if you're doing light exercise, so walking where you're able to have a conversation with somebody, that should be probably up to 300 minutes a week. So 150 to 300 minutes, 30 to 45 minutes a day really is what is required. Interestingly, an area that's coming to the fore, two areas actually, is firstly the additive effect of exercise. So there's increasing research that shows you don't have to do the 45 minutes in one go, that as long as you're active, 10 minutes here, 15 minutes here, even, if you have a really pressured day and you only have those 15 minutes to go for a walk or walk up and down the stairs or whatever it might be, those cumulative effects are significant. They're telling, they reduce your risks. And that's important. The other area that's coming to the fore increasingly is the importance of resistance exercise, so some strength training. And the new guidelines say that at least twice a week you should do exercise that stresses your muscles from a strength point of view. Now, that doesn't mean you have to lift weights, but it might mean some press-ups, body weight exercises, etc. And that's shown over the years to have had benefits on things like bone density, which particularly for women is important. But increasingly, strength training is being shown to have the same effects from an overall health point of view as cardiovascular training. So the ideal is really to combine the two. So if you can have a hybrid of some strength training and cardiovascular training, that's ideal. There's some very interesting research, but the take-home message is it really should be like brushing your teeth. It's just part of your routine. You do it every day. My children laugh at me because I have a saying, make your day harder. So you just got to think about trying to bring physical activity or a little bit of exercise into anything that you do. And if you have a sedentary job, then make sure you can somehow break that routine by getting up, walking around, doing some light resistance exercises, walking up and down stairs, that sort of thing. Just make it a very conscious thing, certainly in the beginning, and ultimately it will become second nature and the benefits will flow.
It is amazing how we have set about making our lives easier in every possible way. So our remote gates, our remote garages, our TV remotes, wishy-washies to wash our cars and washing machines to wash our clothes. So everything that was physical in our lives, we now don't do. And then we wonder why we are so stressed and actually have no downtime, because I think doing those kind of physical activities actually brings us some downtime in our minds and mental lives as well. So yeah, now that we've got gate remotes and whatever, we can go to gym to push weights instead of
and
pushing.
That's a very good point. You mentioned mental life. So I've stressed the physical benefits of exercise, but the effects of exercise and regular physical activity on mental health are absolutely huge. Those people that have regular physical activity as part of their lives have better mental health. They suffer less from depression and anxiety, and exercise is, again, a very powerful intervention in people who suffer from depression and anxiety. And I think we probably underestimate and have for years stigmatized mental health. But, the analogy I use is exactly like hypertension, like high blood pressure. Some people have it, some people are predisposed to it. Some people have the genetics, which unfortunately, lead to them having those conditions, and we can intervene, we can treat them. And one of the ways of treating most effectively is with regular physical activity. So that's important. We also know that particularly for children that exercise regularly do better cognitively. They concentrate better, they perform better in the classroom. And then the final aspect is obviously the social aspect. From a social point of view, particularly interactive and team sports can be of huge benefit. And that, again, combines the physical, mental, and social benefits of a single intervention. There are not many drugs that can achieve that, and at nearly zero cost. Exactly. So, if you said to someone, I have this fantastic drug that actually will treat blood pressure, diabetes, heart disease, cancer, mental health, and actually make you concentrate better and just make you feel better all around, people would pay a lot of money for it, and it's available to us. So it's just something that people need to think about and build into their routine until it becomes non-negotiable, and they'll soon find they don't really want to do without it.
I think it's sometimes counterintuitive, Jon, and maybe you can talk to this a little bit, when you are feeling depressed or anxious, or maybe you've got pain or some other physical condition, that you don't feel like exercising. And so you feel like it would be better for you to lie on the couch or jump into bed or whatever. And I think that's something that stops a lot of people. They're almost afraid that it won't be good for them to go. So, can you talk a little to that?
I think you're right. And perhaps it's just the way that we have been taught, or we've been sort of wired to think about physical activity, that it's something that has to be strenuous, or it has to be formalized, or it has to be planned. And perhaps if you're a cynic, you can say that we've also been conditioned by marketing and pharmaceutical industry to think that a pill is a solution to everything. And I think back to our medical training, we had very little training on utilization of physical activity, next to zero. And it should really be central to every medical student, physiotherapy student, anyone involved in that industry's curriculum. And so I really blame our training and our conditioning over years. But the research now is irrefutable across the spectrum that I've mentioned. So to not incorporate exercise is really, really a wasted opportunity. And for those people, as you've mentioned, who don't make that connection, the only thing I can suggest is to find something that they like being involved in. And there's so many different forms of activity now. You just look at the number of people who've never picked up a tennis racket and are now playing paddle, who have taken it up 3 times a week with such exuberance that they're injuring themselves. To know that there's lots of activities out there that one can become involved in. And it doesn't have to be, as you say, the Comrades Marathon. There are so many opportunities for people just to do a little bit of exercise, start at a low intensity and with a little time and build it up. And the evidence will be there. They will soon realize that they actually feel considerably better. The other aspect of being sedentary and lying down to try and get over your troubles, honestly, apart from the physiological effect of being detrimental, will actually just allow people to wallow in their problems and not feel any better. So the science is there. People just need to broach it initially and they will feel the benefits.
I think one of the things that people need to remember is that if you can make it fun for yourself, it's much easier to start and it's much easier to keep it going. So if it's to meet a friend for a walk instead of a coffee, or to join a Zumba class, if that's fun for you, or go to yoga, whatever it is, there's just so many opportunities to get your body moving.
It absolutely is. And then it will become something that you don't want to do without. So for me, I happen to like the exercise early in the morning, and it gets my day going, and it's a marker for me to start the day. And even if you're very busy, in fact, particularly if you're very busy, it's often the only time you have to yourself, where you're not answerable to people, the phone is away, the emails are not flowing in, or you don't give attention to them. And it's a really good time to dedicate to yourself. So people need to find that exercise that will be attractive to them and get it going. They won't want to let it go.
And I think the benefit about doing it the first thing in the morning is nothing can get in your way, because no one's going to steal that time from you. It's yours.
Correct. And then late in the day, certainly I find something always crops up, or meeting runs late, or you're running late with a patient, or the family needs you. So yeah, I certainly think that's the case. But also physiologically, if you can elevate your metabolism early in the morning, it's going to stay elevated for longer periods in the day. If you have a reasonably sedentary day and then try and exercise, have dinner and go to bed, then you lose some of those benefits physiologically. So it probably is better to exercise in the morning, but wherever you can fit it in is beneficial. And don't forget those little bits in between. There is some research which I saw at the American College of Sports Medicine, which said that even if you exercise your 30 or 45 minutes a day, and the rest of your day is sedentary, you do lose some of those gains. If you can remain reasonably active, be it 5 minutes during every hour, then you certainly increase the effects of that regular exercise. So just being up and about is very important. And in terms of explaining that, I think back to our days, as cave people, our physiology hasn't really changed. So those people 300, 400,000 years ago had to actually move, otherwise they didn't have food or they were eaten. So it's really we're really wired to move. That's the reality. We're not wired to sit at a desk. And I think we'll get on to discussing a little bit about other healthy habits like food choices as well. And the same applies, in my opinion, is that there were certain foods available in terms of vegetables and fruits and grains and lean meats that I think formed the basis of a healthy diet that sustained those people and gave them their energy and allowed some degree of longevity. And we've forgotten that now in the era of processed foods, and the choices have become too many and have become really poor in many respects. So I just think going back to who we were originally as physiological beings helps solve a lot of problems.
Can you talk a little bit about diet, Jon? I think one of the things that makes food choices really hard is there's so much information about what you should and shouldn't have, and should you be intermittent fasting or should you be staying off carbohydrates and banting. What is your opinion, and how can you help listeners to make the right choice for their body?
So I try and be very simplistic about it, and as I say, go back to original physiology and what foods were available to us, and try and make it as simple as that. So there are a few important principles. So the first thing is that anything processed has probably got things in it that aren't good for you. That might be preservatives, it might be high glycemic carbohydrates, it might be all sorts of things which are too much salt. So trying to eat as many natural products as possible, unprocessed food, I think is important. The other thing is that we eat too much. We eat because for many of us who are in a fortunate position, there's food available. And I see now a little email before this meeting, you spoke a little bit about COVID and what happened to people. People during COVID at home were too close to the fridge. That's what happened. And so they ate too much. And that's the reality. So we do eat too much. So whether you believe it's intermittent fasting you should be following, or you call it just something else, I think that you should eat less. If you eat less and smaller quantities of the right foods, you won't pick up a lot of weight at all. So I don't think we need to eat 5 times a day at all. I think we really eat far more, take in far more energy than we expend, and eating, for most people 2-3 times a day at the most is plenty, and eating less of the right foods. So that's for me as simple as it gets. And I don't like the word diet. I like eating pattern. It's a pattern. It's a routine. It's a routine in terms of your food choices, healthy, unprocessed, more natural products. And it's a routine in terms of eating smaller amounts, a couple of times a day. So whether you choose to do that within 8 hours and fast, for 16 hours or 12 hours apart, or 3 times a day and smaller quantities, I think it's fine. I don't think people need to be prescriptive. I think following those broad principles really will be all that you need. And I'm also not a great fan of, testing for this and genetic testing and blood testing. I really like to stick to the basics, not overcomplicate it. Just use, eat smaller quantities of the right foods, and I think you're going to be fine.
I think there's so much wisdom in that, and I think one of the problems in our modern society is that so much of our entertainment and pleasure comes from food. And I think there's so much other pleasure and entertainment available, partly through exercise, partly through using the other senses of the body. And it's such a pity that so much of the pleasure that we get comes from food, and it does lead us to eat too much.
And I think that's partly right, but there's nothing wrong with going out for a nice meal, and a couple of glasses of wine. You just don't have to do it every day. And it should be the treat that it's meant to be, and doesn't mean that you can't have some bad food choices every now and again because it's nice. But I'm talking about the routine. What you do most of the time on most days should really be in a routine, making those good choices. And then it will allow you to go out and have that odd dessert which you wouldn't normally eat. And maybe, 5 or 6 day a week rule, and every now and again breaking it is fine. And also don't downplay the social aspects of, entertainment and food, etc. But that is probably the exception and not the rule. And the other thing, of course, is that it doesn't mean because you're in an entertaining environment, you can't make good choices. There are lots of good food choices available in your house when you're entertaining, with your family when you're eating together, and even at restaurants. There are plenty of food choices that you can make that that allow you to combine the social aspects with a healthy lifestyle. And of course, being in a social environment is good for your mental health anyway. So you've just got to have an awareness, and you look at the menu, you can make those choices which come from those principles that we've spoken about in terms of more organic type of natural foods, which taste good. And I believe once you develop a taste for those foods, you often don't really seek out those sort of sweeter, higher fat options. So, it's really a question of making the right choices most of the time.
I think, I've just written a book called The Sweet Spot, and I do think it's about finding that sweet spot. Moderation is key. Yeah.
Correct.
So how do you think people can get started, Jon? Sometimes I think people don't start because it's overwhelming. It feels like such a big project, they postpone it for tomorrow and procrastinate taking that first step. Have you got some suggestions about that?
Well, the first step is a good way of putting it, and I think it's exactly about doing that. I think it's about starting small and building up and finding what you're able to cope with and feeling the benefits. At some stage, there needs to be a degree of responsibility. It's not just going to happen by itself. So people have to think about it, understand what they're trying to do in terms of their lifestyle, and then set about doing it. Now, sometimes, unfortunately, that happens after a shock, an illness to themselves or a family member, or a visit to the doctor with a diagnosis they weren't expecting, and then trying to intervene. But on the basis of our discussion in the last 20 minutes and the power of physical activity, they should really think about it and start intervening. So those food choices is an important thing that we most of us have some control over. And then from an exercise point of view, just to understand that exposing your body to regular physical activity is about adapting to what is the stress of physical activity and allowing your body to make those physiological changes, which will make you a healthier person. Now, if you're really unfit, perhaps carrying extra weight and feeling as if you don't have the energy, then literally small amounts will make a difference. Now, the point we made earlier about those 10-minute bursts might be especially applicable to that group. And maybe just setting about with 10 or 15 minutes of walking or stationary cycling or whatever you can do once a day is the way to start. But things don't just happen, Sue. You have to think about it, and you have to take some degree of responsibility and make a decision. And I think that's important. Now, I'm sure both have patients who come to us with various ailments, and we know that underlying it is poor conditioning, carrying too much weight and not being physically active enough. And they're seeking a manipulation or an injection or a prescription that will resolve that, whereas actually the right lifestyle choices is the correct place to start. So I'm not going to dilute the fact that some degree of personal responsibility is very, very important. But the information is out there, and people know that. People equally know that smoking is not good for you. They also know that physical activity is. So if you're not prepared to take on that responsibility of incorporating physical activity and good food choices into your lifestyle, then you will suffer the consequences. And you can educate people and push them so far, but ultimately they need to make that decision. And if you've made bad decisions for much of your life, it's never too late to change. And that might just be with a 10-minute allocation of time to start doing some physical activity. And as you said, finding something that will allow you to cope. Sometimes taking something on too ambitious, so you don't want to join the tennis club because it means 30, 45 minutes and you're not up to it. So taking that personal responsibility to intervene and start on your own with a group who's equally unfit might be the way to do it, or with a trainer that will help you very slowly to build up. But there's no harm in building up slowly. Doing something is better than doing nothing, but making that conscious choice is very necessary.
I think you're absolutely right. I think sometimes people are looking for an instant gratification. They want a magic wand that can give them the solution immediately, and therefore they take diet pills or they take medication rather than the slow, steady stepping towards better well-being. And I think
Quite right. The other side of it, of course, and just to warn people about being over-exuberant, is that exercise is absolutely beneficial in protecting your health. But if you are going to have an event, particularly a cardiac event, and I'm talking like a heart attack, and you're not conditioned, it's more likely to happen when you are exercising. So just make sure that you build up slowly. If you are 40 or over, and particularly if you have a family history of any heart disease, strokes, any chronic medical condition, diabetes, blood pressure, it is advisable to see your doctor and just make sure that everything's in place for you to start doing an exercise program. You don't want to start a resistance training program if you have very high blood pressure. You want to be careful that you don't have a family history of early death from cardiac disease and embark on some sort of moderately high intense program which might place your heart at risk. So just in your thought process, as we mentioned, it has to be a conscious decision. As part of that conscious decision at the beginning, it must be, what is my risk? I'm 30, I have no family history of any cardiac disease. I'm not really that much overweight. I could lose a couple of kilos. Then it's fine. You can start embarking on a program. But if you're 45 and you had both parents who had a heart disease when they were, in their 40s, and you've smoked for 15 years, then I'd suggest that you get some medical advice in terms of your suitability for more intense exercise in particular.
I think that's very wise. And are they, can you talk a little bit about the risks of getting injured and what you can do to mitigate those risks?
So exercise and the benefits of exercise come with adaptation. So it's an adaptation to what is a physical stress, physical activity, and it's a very positive effect. Injury is a failure to adapt. So injury really can be divided into two broad groups. One is acute or traumatic injury, which is, for instance, the hamstring that tears, or the ligament that snaps, or the tendon, the Achilles that tears as a result of overexposure. And the other group of injuries is overuse injuries from doing too much of the same activity too often. And as we go through various age groups, we are predisposed to different sorts of injury. So the young growing child may have, for instance, growth plate injury because they're growing parts of their bone are weak. The 20-year-old who's strong and exercising exuberantly will potentially more likely tear her or his hamstring or other muscles. The middle-aged person whose tendons, blood supply is deteriorating will have tennis elbow and golfer's elbow and Achilles tendon problems, etc. And as we get older, our bones become fragile and we might be at risk of fractures. So those sort of age-related processes are part of life, but essentially allowing for adaptation is really what will help you prevent injury. So that means that you expose yourself to small amounts of exercise at incremental intensities. You don't go too hard, too fast, too soon. And the second thing is that you allow for recovery. So you don't exercise at a high intensity the same way every single day. You may have days that are harder. You may have days where you exercise for longer and lighter. You may have days where you do other things like just stretching or some yoga to allow for recovery of those other areas. And this is something that scientifically is called periodization. You break your training into periods of higher and lower intensity, you incorporate rest. And people are always surprised to hear this, but you get fitter while you're resting, not while you're exercising. Exercising is the stress, and then the recovery periods allow you to make the physiological adaptations to become more endurance fit, stronger, more flexible, etc. So it's a process, but generally if you start slowly and you build up in small increments, perhaps something like 10% every week or 2 weeks, then you're unlikely to become injured. The other aspect is warming up, particularly as you get older. We often want to rush into an exercise routine, and I think this is partly responsible for the flurry of paddle injuries, is that many people just grab the bat and get onto the court. And particularly as you get older, as part of that adaptation to exercise, you need to just gradually warm the muscles up and stretch them out for 10 minutes, just to allow the body to adapt to what's coming up.
And I think you've touched on it, Jon, but in addition to all that wisdom that you've imparted to us, I think variety is also important. You don't, I mean, when I first started training for comrades, I didn't know any better, and I literally just ran 10Ks every day at the same pace and the same time in the same way. I didn't know anything about variety, but I think variety is key. You've touched on it, but maybe you can say a little bit more about it.
So variety is a key in two areas. So one is that you need to expose your body to different stresses and gain the benefits of different forms of exercise. I spoke right in the beginning about the science now showing how beneficial resistance training is. So you not only need to be cardiovascularly fit, but when you're 70 years of age, you want to be able to get up and down stairs and out of chairs, etc. So you need to have that strength as well. And the sooner you start developing that, the better. And then a degree of flexibility is also important. So there are different aspects of strength fitness that you need to attain and maintain. And then in terms of recovery, one needs that variety as well. So by doing, some speed work one day and then a little bit of slower endurance work the next, you allow different energy systems to be employed and to adapt and to recover during their rest period. And it also becomes more interesting. If you're doing the same thing every day mentally, it's not as stimulating. If you give it some thought and vary it, it really does become much more worthwhile. And again, there's got to be a conscious aspect to this process. It doesn't just happen. And if you're feeling sore or tired or stiff, then perhaps something needs to change, and then some recovery is required, maybe even some professional advice. But for the most part, it's common sense, but variety is an important part of that.
And you've talked a lot about rest. Can you share with us your thoughts about sleep being absolutely imperative to a healthy exercise?
So you're talking to one of the world's great insomniacs, and I just wish I could have more sleep because I know the benefits of it. So last night, I really had a good night's sleep, and today I feel the benefits of it. So sleep is so critical for recovery, both physical and mental, and to allow those adaptations to take place and to allow your brain to recover. We know that people who go without sleep, as much as sometimes we wear it as a badge of honor, which we really shouldn't, don't recover well. And some of the research around dementia is really showing that a significant amount of it is due to lack of recovery and sleep. So it's certainly one of the aspects that permeates into our lives if we don't allow for it. And it will build up higher levels of stress. So just like exercise is important regularly, so is a good amount of sleep. How much varies from individual to individual, but I'd probably say most people should aim for at least 7 hours on most nights. 8 hours would be great. 9 hours is fantastic. But it's also the quality of sleep. That's important. And there's certain things which interfere with the quality of your sleep. Obviously, stress is one of them when you have things on your mind, but also things like poor eating, being overweight, and alcohol. Those things affect the quality of sleep that you're able to attain. And even sleeping pills, prescription sleeping pills, don't necessarily give you the quality of sleep, particularly the REM sleep that you need. And so the best is really to try and get natural sleep, at least 7 hours a night. And when you've missed a night of good sleep, to try and make it up if possible. The other area, I mentioned exercise, that can be taken in small bits. Another area of research which seems to be showing benefits is the so-called power naps, those little sleep periods during the day when you maybe have 10 or 15 minutes to just put your feet up, turn the lights off and close your eyes and try and get some rest and recovery, if you have it, may also be of benefit. So the two aspects of it are, again, that variety and recovery during the day, but obviously mostly your sleep at night if you can.
So a lot of people seem to believe that it's okay to gain weight as you get older. And I know especially, menopausal women speak about, well, what can you do? I'm menopausal. Can you talk about the weight gain with age?
I don't think it's acceptable, but there are physiological reasons for it. The hormonal changes, the fact that sometimes we have less energy and we're less active. But I honestly believe that much of it is due to poor lifestyle choices, not eating appropriately and not being physically active enough. Not only that, but I think that everybody understands or knows what their comfortable weight is. Now, you can look at it in various ways. You might look at a body mass index, a BMI. You might look at waist circumference. You might look at, skin fold measurements and percentage of body fat. There's lots of ways to measure it. But I think we all know what our comfortable weight is. And when you're getting a couple of kilos over that, it starts becoming less comfortable. Now, either you just buy bigger trousers and you keep going with that, or you pull everything into line. Now, pulling everything into line means getting back to your target weight. Being your target weight will allow a lot of things to fall into place. It will allow your energy levels to be better, will pull your blood pressure into line. It would, in all likelihood, bring down your cholesterol and your sugar. It will take the stress off your joints and make your joints less achy. So I really believe that trying to maintain your goal weight is very, very important. How do you do that? You need to weigh yourself. Everybody needs to know. We're scared of the scale. Now, I'm not scared to put a patient on a scale or tell them to weigh themselves. I think it's very important. It's part of making that conscious effort to look after your weight. So again, my family thinks I'm a little obsessive, but I'm really not. It's just part of my routine. I have a scale at my gym entrance and I just get on it in the morning and I just know where I am. And I think it's an important part of understanding who you are and what you're trying to achieve, is just to keep things in line. Now, I certainly acknowledge that over winter, I probably, do eat a little bit more and you pick up a couple of kilos, but I'm also aware of hopefully how to pull that back into line. But I think it's a very good point that you raise, is that I don't think it's acceptable to start picking up weight. And if you think of 2 kilograms in a year, that doesn't sound like much. But over 10 years, that's 20 kilograms. And then it's much harder to pull back. So I do believe that people need to try and keep to their goal weight as much as possible. And if you're not sure what that is, then get to your doctor and work it out. But I think just logically, most people understand what they would like to be. And very often I have patients coming in and they say to me, oh, I'm tired, or I've got sore knees, or, this ankle doesn't want to get better. And I quite bluntly ask them what they weigh and what they would like to weigh. And if they're 15 kilos over, I say to them, let me give you 15 kilos to carry around all day and see how your back or your knees feel. So maintaining your weight is very, very important, and trying to get it back to where it should be will really help change how you feel. It will reduce your risk of injuries and make your chances of good health much better.
But for some of us, it's much easier than for others. It really is like that. I think some people talk about how obesity is an inflammatory condition, and I think there are some people who whether it's inflammation or poor gut health or whatever, just do struggle to maintain their weight. And yeah,
I
have you
think
got
that's
any?
fair. I think it's fair that it's not always easy for everybody, and everybody's physiology is slightly different, but it still comes back to the same principles, and that is trying to make the right food choices and being physically active. So if you're overweight and physically active, you still get significant benefits from that regular exercise. If you're overweight and you still make the right food choices, you get a lot of benefits. Exactly what you mentioned, reducing inflammation, maintaining good gut health. It still comes back to the same principles. And if you're finding that you're not losing weight despite making those good choices, then I think that's where maybe some medical help comes in. Firstly, to determine what the underlying potential cause is. Maybe there is a hormonal issue, an underactive thyroid, other sort of hormones which are out of sync, low testosterone in males, etc. There are potentially causes which can then be treated. But I firmly believe the principles are the same for everybody. And if you stick to that, the benefits will come with it.
Just wish it felt as easy for everybody as it sounds. But yes, I think taking responsibility for your weight is a huge aspect of staying healthy. Jon, what would you say? What would you say would be the best place to start if you're really carrying a lot of weight and you haven't exercised in years? Would you start with trying to lose weight, or would you start with trying to exercise first? Because often the two produce a downward spiral. You have low energy because you're carrying excess weight, and so you don't feel like exercising, and so your consumption of energy is less. And can you suggest where people should think about starting if both are a problem?
I think the way to start is with some introspection and deliberate thought about what you want to achieve. So, and part of that would be an understanding that there's no quick fix, that it won't happen quickly, and it doesn't have to happen quickly. And that's fine. I mean, starting to set targets of 2 kilos a week or this or that, I think starts putting unnecessary pressure. I think starting with the understanding that better food choices and regular physical activity will benefit you, even if you can't see those benefits necessarily, particularly in the beginning, is a good starting point. And then to determine how you're going to implement both of those. The food choice thing, I think for many people can be achieved if they strategize and understand what they're trying to do and what the good and bad foods are that they want to include and leave out of their diet. The exercise is really about what appeals to you, what you can do. So if you are overweight and you have arthritic knees, then probably starting on a walking program is not necessarily easy, but doing some resistance exercises and possibly cycling, swimming may be better for you. And then if you're not sure, is to look for help. So that might be formal help in terms of medical input, or it might be some credible online source that might give you some sort of input, or it might be a friend who's done it. I don't think being out alone is a nice feeling. So you want to know that there's some support basis there. People that have been through it or understand the benefits will be there to help you. But again, I come back to this issue of making it a conscious choice. I do think at some stage there needs to be some thought process, and there has to be a degree of responsibility and planning for it.
And another question around the barrier to exercise and healthy living that I hear a lot in my treatment room is busyness syndrome. I think people have, especially since COVID, work has bled into their home life, and people have got into the habit of working 14, 15 hours a day. And yeah, there is no time for exercise. Yeah, I mean, you've talked about peppering your day with movement. But yeah, it is a problem I think people are really encountering.
It is. I mean, people are busy, but that's where, that's where that planning comes in. That's where the early morning session comes in. You're unlikely to be on a Zoom call at 5:30 or 6 in the morning. It's possible, but probably you're not. And maybe that's the time for you. Or maybe, if there's a break in the middle of the day, that's the time for you. But again, I think it comes down to planning. If we wanted to, or we didn't want to, none of us would exercise. We would just, we could just sit and be busy or be preoccupied with other things. But I think that if you think about it and you understand the benefits, and also perhaps strategize that you're going to be more productive in the rest of your day, have more energy, and be able to focus. Think of all those benefits that we spoke about regular physical activity. It is going to make you want to exercise. And once you get into that routine, as you know, you don't really want to break it. If someone takes it away from you, then you complain. So again, I think we can all come up with excuses for poor lifestyle choices, but if you focus and you actually plan for it, it actually becomes quite doable. Most of us can find half an hour somewhere to do it. I know some of the busiest executives in this town, and they will not let their exercise session go. Whether it's a boxing class or it's there 3 times a week on the tennis court or squash court or their gym session, they do factor it in. So, some of the busiest people find time to exercise. And I think most people can find the amount of time that we're talking about.
And I want to know what you think about over-exercising. There are many people, especially in Joburg, who are absolutely passionate about cycling, who are cycling with the young guys and really going for it at a really high intensity. Do you think there's a downside to overdoing the exercise as you get a little bit older, or do you think you can just listen to your body and just go for it?
I think listening to your body is good. I also think doing what your body is used to is important. So, being 50 and deciding you're going to cycle 4.5 hours on a weekend with the youngsters just because you have some time available is not a good idea. Having a good cycling pedigree and having done it for 20 years and being able to do it is fine. You'll probably out-pedal some of the youngsters. So I think it's all about what you're used to and how you've built up to that level. I do think, as we've mentioned, rest, recovery, and variety are important in that process. I think if you really are exercising, and the opposite of what we said, that you actually exercise so much you can't find time to do other things, that's problematic. I mean, there are issues related to some people who are obsessive about their exercise, and that's sometimes, also paired with eating disorders or disordered eating. So, one has to be very conscious about this sense of balance and also about adaptation, doing what you're used to. So can you over-exercise? Absolutely. You can fatigue, you can get overtrained, you can become injured. And certainly, I think some people lose perspective. I mean, we all know people that have done 28, 30 comrades, and I just think, well, is that something that's really beneficial to you? Can we not do other things? I don't have the answer. I'm just thinking that sometimes that sense of balance is lost. So yes, you can over-exercise, but if you stick to the guidelines, I think you're going to be fine.
Have you got any nuggets that you'd like to leave with us, Jon? Because you've given us so much food for thought, but any extra nuggets that we could take away?
Yeah, I don't think there's a nugget of gold out there that solves everybody's problems. I mean, I just think the issue around physical activity is so important, and healthy lifestyle choices are so important, that in this day and age where there is a lot of stress around, that there are difficulties in terms of creating a healthy environment, the choices you make are critical. And two of them, in terms of dedicating time every day to do some physical activity where you raise your heart rate and you're a little bit out of breath, and having the right foods as much as you can in your cupboard and fridge, and eating a little bit less of them, are two critical interventions which will really change the way you feel and will change the quality of your life and reduce your risk of poor outcomes. So I don't have any magic golden nuggets. It's just a question of giving it some thought and making those choices, and the benefits will be there for everybody to reap.
There is no magic wand, even from Professor Jon Patricios. It is just about slow, steady, wise choices over and over again, I think, is what you're saying.
That's correct. I mean, it doesn't mean that every now and again you can't do something out of the ordinary, or push yourself a little bit, or give yourself a treat or whatever. In fact, that makes the journey more exciting. So that's fine. But it's the general trend and lifestyle choices that ultimately will get you through. So, I just think people need to, I use the analogy of brushing your teeth. It's the same. We wouldn't dream of not cleaning our teeth a couple of times a day. It's part of our routine. It's what we do the beginning and the end of every day. And it should be the same with these other lifestyle choices that just become part of your routine, because if you don't do them, you feel awful.
Jon, thank you so much for all of this wisdom and information, and sharing the research with us, and your research especially. And I really hope that people will listen to what you've said. If they want to get hold of you, what's the best way for people to get in touch with you?
I think you can Google, and my contact details are there. And I've also got the easiest email address in the world. It's jpat, JPAT @mweb. So that's very easy. And then I'm usually quite good at responding. jpat@mweb.co.za.
Brilliant. Thank you so much for your time, and I wish you a really great evening further.
Good. And thanks for this show and for everything you do to promote health and wellness, Sue. Thank you for having me.
Thank you, Jon.
Please push the subscribe button so that you can be alerted when future episodes are available. Thank you for listening.